Welcome back. This is Head and Neck Cancer Awareness Week in the U.S. And today's Doctor on Call segment, we're very happy to welcome in Doctor Chog Shing Loo with Ascension Medical Group to talk about this very important topic. Dr. Loo, thanks for joining us.
Thank you for having me.
Could you talk a little bit about what head and neck cancer comprises of?
Head and neck cancer is a very broad spectrum. So if you count head and neck skin cancer inside, yes, the incidence rate is super high. So when we talk about head and neck cancer, normally we don't include head and neck skin cancer. So very common cancer for head and neck otherwise include tongue cancer, which we normally call the most common head and neck cancer besides skin cancer. And after that, we have throat cancer, mainly base of tongue and tonsil, and voice box cancer.
Okay.
Yeah, and the skull base, we also include that into head and neck cancer category.
Who's most at risk, and what are some of the symptoms someone would go through?
So the symptoms really vary, and the most common symptoms are ulcers, like a non-healing wound inside your mouth, of your skin, and some swallow and eating dysfunction, some voice change, like a persistent sore throat, and you can cough up blood sometimes. The people at risk are those who are smoking as the most common risk factors. And nowadays, people are talking about virus infection. HPV virus infection is one of the most common virus causing throat cancer, mainly tonsil cancer and base of tongue cancer.
So you say kind of smokers is what you commonly see to get this type of cancer. What are the ways to treat this type of cancer?
For head and neck cancer treatment, majority of them are treated with surgery first, except some special type of cancer, like we mentioned, HPV-related tonsil cancer and base of tongue cancer. Especially if it's a little advanced, you treat it with the chemoradiation first. At the back of your nose, we call nasopharyngeal cancer, which is most commonly related to EBV infection, and we treat that with radiation plus minus chemotherapy. And for voice box cancer, early stage, you can treat it with either surgery, minimally invasive surgery, or you can treat it with radiation only. But for more advanced, we normally treat it with the surgery.
Now, your program provides all these services and treatments.
Yeah, my program covers all the whole spectrum, even from precancerous lesions to the very advanced cancer. We do all type of surgeries to remove those cancer, and most importantly, for head and neck region, you want to do reconstruction to preserve the function and the form, mainly cosmetic standpoint. Free flap, we do all type of free flap to rebuild head and neck to preserve the function and the formality.
Well, Dr. Loo, thank you so much for being here and giving us this important information about head and neck cancer. Thank you so much.
Thank you for having me.